Hi, I'm Dr. Judy Gooch, and I'm here with Brainstorm for Brain Injury. Here is actually visiting my daughter and son-in-law and grandsons in London, England. So it's actually 7 p.m. here. So Brainstorm for Brain Injury four of us started it a couple of years ago. We are professionals. I'm a rehabilitation doctor that works with people who have had brain injury. We have a cognitive therapist that works with people who've had brain injury, and we have family members of brain injury survivors. And we started Brainstorm for Brain Injury because we are frustrated with treatment for the availability of treatment for people with brain injury and the lack of understanding that many people have of brain injury. So here we are. Today, and hopefully every couple of weeks, I'm going to share a story of someone who has had a brain injury and an issue that they are dealing with, and how they are working through that issue, hopefully to improve understanding of brain injury. So today, I'm going to talk about Angela. Angela was 53 when she was hit by a car about a year ago. She fractured her pelvis, she fractured her femur, or her upper leg, and she fractured her skull, and she had multiple areas of bleeding in her brain. She was comatose for a while. She spent 3 weeks in the hospital on the acute care floor. And then she spent 2 weeks on the rehabilitation floor, where she improved again her ability to walk and to talk. For a while, she wasn't walking, she wasn't talking, she wasn't using her arms. Again, she was pretty out of it. So after she finally got out of the hospital, she had a right hemiparesis. She was weak and tight on the right side of her body. Most of the injury was on the left side of her brain. And remember, the left side of the brain controls the movement in the right side of the body. She also had word-finding difficulties. In most of us, the speech area is mostly on the left side of the brain. She had trouble walking. She was walking with a cane. She was able to use her right hand, but it was difficult. And so after she went home, she got outpatient physical therapy to work on her walking, occupational therapy to work on her hand use, and speech therapy to improve that word-finding ability. But most importantly, she worked every day to practice at home to improve. Even though you go to therapy once a week, what's much more important in improving after brain injury is what you do every day to practice at home. But Angela's most troubling issue was fatigue. Fatigue is really common after brain injury, but not fatigue like Angela had. She was sleeping 10 hours a night. She seemed to be sleeping pretty well, but she needed 30 to 60 minutes of rest after any household task. She needed a rest after taking a shower. She needed a rest after vacuuming a small room. She needed a rest after eating a meal. Angela was totally drained, and this was not getting better. Now, you have to know that prior to the injury, Angela was working full-time at a school. She biked, she hiked, she swam almost every day. She traveled a lot, and she helped take care of her grandkids. But now, she couldn't even go for short walks, primarily because of the fatigue. She really couldn't take care of her grandchildren because it made her way too tired. So, again, fatigue is common after brain injury, but not fatigue like this. I mean, it was just profound. So, we thought it was important for Angela to really evaluate this fatigue. Why is this going on? And there's a number of reasons for fatigue after brain injury. First of all, you can just have fatigue after brain injury. Brain is kind of working overtime, and that makes you tired even when you think. But other causes can be hormonal. The pituitary is in the brain, and that's the command center of the endocrine system, or the hormones in your body. And that can get injured in a brain injury. And then you might have low thyroid. As you probably heard, low thyroid can make you pretty darn tired. So that's important to check. She might also have sleep apnea, where you're not getting enough oxygen. You kind of stop breathing periodically at night. You don't get enough oxygen to your brain. That can lead to a lot of fatigue. That is pretty common after brain injury. And you do not need to snore to have sleep apnea. She might have anemia, where there's not enough red blood cells. That can make you tired. It's possible to have heart problems. It's also possible that certain medications can make you really tired. So anyway, we're going to evaluate all of these things in Angela. I don't have any answers yet, but we'll come back in the future, hopefully, and let you know if we found something. If we found something that we can correct, that's fabulous. If not, there's other things that you can do. It's important after a brain injury to take regular rests. We call them brain breaks, like every 5 minutes or every hour, take a 5-minute rest. That can really be helpful. Also, there are medications that can help with fatigue. So I'll let you know how she is doing in the future. Thank you.